Thanks, Shamini. Thanks everyone for coming to Thorne Harbour Health in the Spotlight today. I also, before we go any further, would like to extend my acknowledgement to the Wurundjeri and Boonwurrung people of the Kulin Nation, on whose lands this webinar was developed. I am coming to you from Wurundjeri land, but Thorne Harbour Health's offices is located on Boonwurrung land, and both those lands are part of the Kulin Nation. So I'd like to extend my respects to their elders past and present. I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us on the webinar today. So first of all, to start us off about Thorne Harbour Health, we have a very handy YouTube video which gives a little bit of an overview of the organisation's origins and its histories and where we're at now. So I'm gonna hand back again to Shamini to play that video and to do that part of the screen share. Is that okay, Shamini?
Yep. So I'll just do that now.
For the past 35 years, change has been the one constant in the work of our organisation. As the HIV epidemic has changed, our organisation has evolved. We are now responding to a broad range of issues that affect the health and well-being of our community as a whole, with issues such as drug and alcohol use, trans health, family violence, lesbian health, homophobia, transphobia, biphobia, and stigma and discrimination faced by people living with HIV. Our work has also moved beyond Victoria, with health promotion programs and projects that are national in focus. Halfway through the fourth and hopefully the last decade of the HIV epidemic, the time has come for our organisation to reflect the changes faced by our community, while maintaining the legacy of activism that created us in the beginning. In 1983, at the first public meeting to address the developing health crisis of HIV and AIDS, one voice stood out amongst the many. Feminist and activist Alison Thorne motivated and mobilised the community by asking, "What are we doing about this, and how can we do it?" It was Alison's rallying cry that ultimately led to the formation of the AIDS Council. Keith Harbour became president of our organisation in 1987. A man living with HIV, Keith was a pioneering leader who mobilised the community from high-level political policy to grassroots activism with the AIDS Coalition to Unleash Power, ACT UP. Keith continued working to get access to life-saving medicines for people living with HIV until the day he died. In aligning our new brand with leaders like Alison Thorne and Keith Harbour, we're not simply acknowledging the legacy of our past. We're also recognising that the care, health and well-being of the gender and sexually diverse communities will need bravery, commitment, inclusion, imagination and vision. We are now Thorne Harbour Health, and we will continue to work for the dignity and well-being of our communities, now and into the future. Thorne Harbour Health, for the future.
Thanks, Shamini. Can everyone see my screen still?
I think you'll have to reshare.
Okay. One moment. Okay. How about now?
Yeah.
Okay. So that was the official video that was made by Thorne Harbour Health in 2018 when the organisation changed its name from the Victorian AIDS Council, as the presenter said, to reflect the myriad services and going into the future. So a little bit more about us. So this is a list of the services that Thorne Harbour Health provides. We have a general counselling program for LGBTIQA+ identified people and their families and loved ones. We also have LGBTI clinical services, which comprises a clinic. We have a trans and gender diverse health clinic, a medical clinic called Equinox, which is located at 200 Hoddle Street, which is the same building where our counselling services and family violence services are located. We run trans and gender diverse health programs, group programs, health promotion and peer education. We have alcohol and other drug counselling services and group programs, including the quite well-known and successful program for men who are seeking to change their meth use, which is called Rewired, which has a number of groups, some peer groups and some practitioner-led groups. We do have therapeutic groups as well for a range of people across different ages. So we've got a lot of groups for young people, people who are trying to deal with the impacts of homophobia and transphobia and biphobia on their lives, and as well as groups that are specific to, sexuality or gender groups. The sexual health services we run include a rapid health testing service, which is called Pronto, where people can come and get a free STI check and get a rapid testing service for HIV. We also, part of our health services is education campaign around, staying negative or preventing HIV transmission through things like PrEP or biomedical intervention, as well as condom use and other sexual health literacy kind of information. If people have questions about that stuff, I can answer some of them as we go on. We also have outreach services, services for people who live with HIV. So we have a building called the PLC, which is the Positive Living Centre in Prahran. That's runs a number of outreach programs, including financial counselling and a Housing Plus program, which is a program for people seeking housing who are HIV positive. There's quite a few programs we run, so there's a lot to cover. Something that Shamini mentioned that a lot of people were interested in was the regional and rural support that Thorne Harbour Health provides. We have which is situated in a community hub in Bendigo, and we also have at the moment the capacity to provide telehealth appointments across all teams across the state. So perhaps that's kind of an outline to the services that we provide. If people have further questions, maybe pop them in the chat and I'll try to address them at the end. But I want to speak a bit more specifically about our family violence services. Before I kind of give you an overview of the services that we offer as the family violence team at Thorne Harbour Health, I just wanted to share a little bit of why it's so important that we have a responsive service sector to LGBTIQ people who experience partner and family violence. So this report, Private Lives 3, this data is from before COVID, I believe. So it came out in 2020, and some of this stuff has probably shifted and changed as with much kind of demographic data throughout the kind of the onset of the pandemic. But it's worth noting that more than 2/5 of participants who participated in the study reported that they had ever been in an intimate relationship where they felt they were abused in some way. Almost 2/5 also reported ever feeling abused by a family member. Of the participants who reported having experienced intimate partner violence, 28% said that they reported the incident to a relevant service at the time that this occurred. So that could have been a LGBTIQ service, a family violence service, a medical practitioner, and that's quite a low number. So that's only around 30%. Almost half of the participants who were surveyed reported that they had ever been coerced or forced into sex acts that they didn't want to engage in. And almost 10% of the participants reported that that had happened to them in the past 12 months. So these are quite high statistics. They're definitely comparable to, I guess, the heterosexual population, to whom most family violence services are broadly available. So I guess that's part of why it's so relevant that we try to have a responsive service sector when it comes to LGBTIQ people experiencing violence in their families or in their relationships. So a little bit about what Thorne Harbour Health offers. We have a specific dedicated family violence team with practitioners who provide specific services. So what I'm going to cover today are those services. So we run services for victim survivors of family violence, for people who have used violence in their families or relationships. We also provide brokerage. So we have some crisis funding, which is available to people who have experienced violence and people who have used violence. And I'll get into that a little bit more later. And we have flexible support packages, which is to support the recovery from having experienced intimate partner or family violence. We also have counselling, so a general kind of family violence counselling program that are run by counsellors with experience in this kind of area. We have case management. We have a men's behaviour change group, which is for gay, bisexual, transgender and queer men and masculine people. I say that because it's men's behaviour change is the Victorian standard language for groups for men. So perhaps not everybody who comes to that group identifies as a man. So we kind of try to open it up to people who identify as masculine and within the reasonable cohort. So that group is called Revisioning. We also provide secondary consults and training and capacity building. So there's a dedicated team of which I am a part, which is a training and capacity building team. Okay, so we do a lot of things. I'll tell you a little bit about services for victim survivors, first of all. So as I said, we provide individual family violence counselling and case management. That we also provide support to people with children and provide support to their children. So similar to any other kind of family violence service, we have a responsibility to children as well, and so we can provide counselling either one-on-one or with the family. So we provide counselling case management for LGBTIQ people who have experienced violence. We also extend that to people who might not identify that way, who are living with HIV or perhaps have recently become HIV positive. So that's something to keep in mind. If somebody who you're working with is not LGBTIQA+ identified, but they are living with HIV, then it may be relevant to kind of refer them to us for service. At the moment, our wait period is around 3 to 4 weeks, which has been fairly consistent over the last 6 months at least. Basically, we work through that wait period based on presentation. So any complexity of somebody's presentation, any risk factors. And while people are on that wait list, they're supported with active holding via phone. We have an intake team, one of which is a dedicated family violence intake worker. So that person has kind of the experience and expertise to, I guess, assess risk in an ongoing and kind of dynamic capacity. As I said, we have some brokerage support. So these are the 2 different types of brokerage support available for victim survivors of family violence: is the flexible support packages and the family violence crisis brokerage. So the first thing that I want to talk about is the flexible support packages that are managed by Thorne Harbour Health. So FSPs they're available to victim survivors of family violence who identify as LGBTIQ or are HIV positive, as I mentioned before. And for people who have left the relationship or the family situation where they were experiencing violence and who no longer reside with the person who's using violence. So the reason for that is that flexible support packages aren't able to be used in any way that might benefit a perpetrator, is the kind of rationale for that. And that's fairly standard across all organisations who administer flexible support packages, of which there are a number. So a flexible support package is intended to support safety and recovery from violence. So applications can be made for financial support for quite a range of things. So I've given some examples just because often people find themselves wondering, oh, I don't know what could be used to support me. So things like items to assist with study. So perhaps like school, a course, university courses, if there's a short course or something like this that somebody wants to use to get back into the workforce after a period of not being able to work because of family violence or something like this, a flexible support package can assist in that way. Sometimes we can support people to have technology to participate in work or study, so phones or computer equipment, this kind of thing. It may be relevant that someone has had that kind of equipment broken or stolen in the course of leaving a situation where they're experiencing family violence. So that's often something that's quite relevant. So services to increase health and well-being. So, physical health, emotional and kind of mental health and well-being. Often people find that physical exercise or engaging in a team sport or yoga or a gym membership can be really helpful for their recovery. I also included allied health therapies. People in the LGBTIQ community are a huge range of diverse backgrounds, and including socioeconomic backgrounds. Not everybody has private health, not everybody has the capacity to pay for private therapies like that. And sometimes people find that that's actually a really wonderful way to kind of stimulate some healing for them after experiencing violence. General kind of material safety services, so car insurance or having their vehicle or their bike repaired, and additional items that may be consulted upon. So that's kind of an overview of what FSP can be used for. One of the main questions we often get is, so how do I do this? How do I sort it out for my client? The application for an FSP can be made internally by a worker at Thorne Harbour Health. So not everybody who works at Thorne Harbour Health and does direct practice client work is in the family violence team. So people who are in the alcohol and other drugs team in our organisation often refer into the FSP program, and that worker would write the application themselves and then present it to the flexible support packages panel, who assess flexible support package applications based on need. So if any of you who are workers from other organisations would like to apply for that kind of brokerage, there are forms. The applications are sent to flexipackages at thorneharbour.org. That's also the email address that you can contact if you would like to receive a blank copy of that application form. So that's a situation where perhaps somebody works in a case management capacity and is doing the case management for their client, and then finds that the client is eligible for FSP and wants to put in an application. So that would be a situation when a worker from an external organisation might put in an application for FSP, and we do process quite a few of those. So it's a pretty regular part of the FSP practice. FSPs, something to note is that it's not intended for use as a crisis payment. It's intended for use as a kind of supporting somebody to recover or after they've moved to safety, hence the myriad ways that it can be used. As it's not used as a crisis payment, that's not intended that way. There can sometimes be like a couple of weeks wait before the application is assessed or something like this. you would be aware that it sometimes takes a little while to come into effect. A similar thing, but less long for FSP. So yeah, it's not meant to be used as a crisis payment. If you want a crisis payment for something like leaving a situation or getting to safety, that is the thing I will talk about next, which is the family violence crisis brokerage. So the family violence crisis brokerage packages are available, and I've put the criteria here in this slide just so that it's really clear. So for people who are victim survivors of family violence, individuals or families, and that includes children, so who have recently experienced or been affected by family violence, and who are receiving support from a specialist family violence service. So that may be any one of you who are here at the webinar today, and for people who are experiencing a financial crisis. Of course, as workers in the family violence sector, we know that often people who have experienced family violence are experiencing the financial impacts of that. So it's very relevant, and it's quite a specific eligibility criteria, but I would say that it kind of encompasses many people who experience family violence. So of course, these family violence brokerage packages are intended for use by people who are LGBTIQA+, and or HIV positive. There is also funding, this crisis funding, available for people who have used violence or perpetrators. I put the caveat down here. It's where the expenditure directly links to reducing the risk to or enhancing the safety of the victim survivors and or their children, and continues to hold the perpetrator accountable for their use of violence. So for this reason, while somebody who's a victim of family violence may be supported to, you know, have a new phone or have their medications restocked or something like this, or you know, have a new passport paid for or something like this, in the event that's been impacted, and it would put undue financial strain on them to have to do that themselves. People who have used violence, this is limited to accommodation and transport. So basically what that often looks like is if somebody needs to be out of the house for the night, and that will increase safety for the family, who are, you know, the affected family members, I suppose, then this brokerage could pay for the person who's been using violence to, you know, get a taxi to a hotel and stay there for the night, as an example. If people have questions about this, feel free to ask me in the question time. So for brokerage inquiries, I have just popped our phone number up on the screen. And if you have questions about this, particularly if it's a crisis brokerage and it's quite urgent, ask to speak to a family violence crisis case manager or the family violence team leader. Failing that, you can ask to speak to an intake worker and they will direct your call. You can also email for all brokerage inquiries to that Flexi Packages email address. So why we just keep it all in the same Flexi Packages email address, because that's where all brokerage goes through, so that there's one place so things don't get missed. So some services that we provide to people who have used violence. So the more kind of change orientated or therapeutic services rather than the crisis brokerage services. So as I said, we have a men's behaviour change program for gay, bisexual, queer and trans men and masculine identified people in relationships. So Revisioning is a men's behaviour change program, much like any other men's behaviour change program in Victoria. So it's 20 weeks. Participants are required to attend for 20 weeks, and it's a rolling group. So like many men's behaviour change programs in different organisations, participants start at different times as they are referred. We only have one group running at a time. So it means that people come kind of at different points. They just come when they're referred. And we find that this allows us to have less of a waiting period, which can increase some safety. So participants for revisioning are referred by courts. So they can be referred by a magistrate's court as part of a counselling order. Sometimes it might be suggested by counsellors or other practitioners. So that, you know, people like yourselves, it might be suggested by, a private counsellor or somebody who they've come across before. And they also attend voluntarily. So we find that some people who, similar to men's behaviour change groups in the kind of heterosexual service sector, sometimes men will attend, you know, because they've heard about it or they've been asked to by their partner, or you know, just as a kind of voluntary thing. So those they are run weekly. At the moment, they're being run online, and we found that participation has been fairly consistent throughout the time that, you know, throughout lockdown and throughout the time that they've been run online, because it's a cohort where eligibility is kind of based on, you know, like identity and the material reality of living as a gay, bisexual, queer, or trans man, or masculine identified person, rather than on a catchment area. We find that it's really great actually to have an online group, as it allows people from very different parts, which is, you know, it's always great when there's observers are very welcome for revisioning, as in every men's behaviour change group. If you would like to observe revisioning, it's revisioning@thorneharbour.org. I've also put these email addresses and the contact details at the end. But the observers are really, really welcome. Feedback is really welcomed. It's a very important part of the practice of, you know, working with people who've used violence, that we talk to each other and we have feedback. Our team, as I've said here, also provides individual counselling and case management for any LGBTIQA+ person who's used violence in their relationship or in their family. So people who might not be eligible for revisioning based on their identity or their presentation. Sometimes it might not be safe for somebody to be in a group. They might have additional presenting factors that mean that they can't do group work safely. Or, for example, they might be a cisgender woman or a transgender woman, or a non-binary person who's not able to attend a group that's for men and masculine people. So in that case, they would be provided with individual work, and that's individual work that aims to kind of hold them accountable for their violence and explore changing that kind of behaviour and keeping the people in their lives safe. So another thing that we offer, which is perhaps particularly relevant, is secondary consultation. So I guess I've got a few things that people might like to consult on. If you'd like to, at the end of this presentation, have a discussion about this, I would also welcome that. We often find people might like to call and discuss a specific presentation or a client that they're working with, refer them to one of our programs, say, you know, if someone is working with a man who has sex with men who also uses meth, they might like to refer him to Rewired or something like this. If it's relevant, adding Thorne Harbour Health or adding a worker to a person's care team. So you might be a mental health worker, or you might be working in a legal context and want to have some kind of co-case management with a person who is also working with somebody. So Thorne Harbour Health, like practitioners like myself, would be a part of care teams, and make those kind of connections based on a person's presentation. Of course, you can request us to share information in line with the information sharing schemes. And we often do the same. So particularly for people who come to our programs for people who've used violence will often request information from the court or other workers. I thought, you know, you might wish to find a bit of information for somebody who doesn't meet the criteria for a women's service. For example, we often take calls from workers who are looking for options for people who are either for perhaps like non-binary or male victim survivors of family violence, as those people aren't eligible for pretty much any refuge or the services that are available to cisgender women. So for that reason, that might be a reason that somebody calls for a bit of a secondary consult. That might also be a reason that a worker wishes to engage some of that crisis brokerage, if it's to keep somebody safe who's not eligible for, you know, support from Safe Steps or another organisation like this. You might like to ring and consult and find out a bit more about FSP. I mentioned that already, so you're very welcome to do so. You may also like to talk to us about our other areas of practice. Maybe you're working with a trans and gender diverse person, or a person who identifies as trans or otherwise outside of the binary. I don't think it's rare that people identify as gender diverse, I suppose. But you might be working with somebody who is wishing to be supported with an affirmation of their gender. Maybe you don't know very much about that, so you could ring Thorne Harbour Health and find out a little bit more about our services. Maybe also there might be a time when it seems relevant to, you know, do a bit of secondary consult around a person's AOD use or alcohol and other drug use. And if you'd like to know more about our sexual health and rapid testing services as well, that might be a time, I thought, when you'd like to do some secondary consultation. We also offer training and capacity building. As I said earlier, I'm part of a capacity building team. So much of the training and capacity building around LGBTIQ and trans and gender diverse affirmative practice is free or is supported by the government. Some of it is fee for service, pretty reasonable rates as trainings go. I know that, you know, trainings can be really expensive. So yeah, we have, I think Thorne Harbour Health has fairly reasonable kind of costs for trainings like this. But also a lot of that stuff is supported by the government at the moment. So if you'd like to get in touch for some training, capacity building around any of the stuff that I've talked about today, I've popped my email address at the end as well. Here's the contacts. I guess it's a lot of information, so I'm looking forward to your questions and comments.